Thank you very much, Mr. Chair. And again, I thank our witnesses for their patience throughout this and then throughout the brief recess as we voted. I am a physician. I'm the former director of the Iowa Department of Public Health, as I had mentioned earlier, and then also as a state senator. And it's a very timely topic. As a state senator, I successfully passed, I can't speak, but passed in one session no pre-authorization for medicated-assisted treatment through our programs, including Medicaid. I was also able to get behavioral health treatment as a site of service at schools. So for those individuals who can't, either don't have transportation or can't get to their providers, so that we make sure that there's a continuum of care. Dr. Westlake, as you referenced in your testimony, what can Congress do? And you mentioned the Halt Fentanyl Act. I'm an original co-sponsor of that, and I agree that there's a lot of misinformation about that. And I'm also interested, so we're kind of sisters. I'm Iowa, you're Wisconsin, and Wisconsin has a program. But in Iowa, we have the Billion Pledge Program, which is another one of Iowa's leading opioid prevention initiatives. Specifically, this program aims to remove 1 billion opioid pills from the medicine cabinets using evidence-based protocols, peer-to-peer education, nurse support, and also preparation for surgery, because as we know, a lot of opioid addiction has started through post-operative care and pain management, pain relief. As part of this, they have a toolkit that has an ice heat pack, nurse responsive, or someone that they can call in addition to their regular provider. It has a nutritional water supplement, which gets to the NPO, or nothing by mouth, for hours before surgery, which leads to increased pain afterward, and then a regimen of alternating ibuprofen and Tylenol. So I think this program is a critical program that, looking at their results and statistics, probably should be replicated. And I know that your experience is larger in the emergency room setting, but you were very instrumental in setting up Wisconsin programs. So I'd like to ask if you have knowledge or information about what can be done regarding post-op monitoring to reduce the number of Americans that come away from a surgery with an opioid addiction, and whether you have experience with enhanced recovery after surgery guided care.
Yes, thank you for the question. I think the education is key. I led the prescription reform efforts in Wisconsin starting 8 or 9 years ago, 10 years ago, and educating the physicians about prescribing. But I think we also need to continue to educate the public. And one of the things is there's a study out of Michigan that's one out of 16 kids that gets exposed to Vicodin for wisdom tooth extraction becomes addicted to it. And so it's stopping the initial exposure. And I think as a society, we have to understand that there are going to be things that are painful. I tell people when they have broken wrists, it's going to hurt. You take Tylenol, you take ibuprofen, you do ice, you take this, take this tramadol or hydrocodone only if you have to at night, and realize that if you take it, there's a potential you could be addicted to it. And I think education is out there, though. I think we're moving forward significantly on that respect. I think prescription drugs are not nearly the problem they were 10 years ago.
Thank you for that. We also have increased access to harm reduction tools, and we've mentioned that, and I remember going through these as director of the Public Health Department. And as beneficial as they are, I just want to also mention that in my meetings with both public health and with law enforcement, that we now also have individuals who are abusing those very same tools that we're using to save lives. So when I'm speaking with individuals in recovery and in law enforcement, mentioning the use of Narcan, overdosing on medication, knowing that there's Narcan available. So I think it's an extremely important tool, but we also have to be cautious and be mindful of that. There's been significant efforts at the federal and state levels to increase access to naloxone, but I want to ask you, Dr. Westlake, in the little time I have, what more can be done to ensure individuals, families, EMS, first responders, emergency departments have the tools they need to give individuals who have overdosed another chance of recovery?
Yeah, I think that's key. I think making it over the counter would be ideal. There's no reason that you would need a prescription for it. There's no side effects to it other than it stops opioids from being affecting the nerve, and so there's really no downside to it. I think that would be a huge step, and then it could just be, it could be widespread much more easily.
Thank you. And Dr. Lloyd, my time's expired, but if you had comments, please feel free to submit those in writing to us afterward. Thank you. I yield back.